I will let everybody, just introduce themselves. We have 4 physicians. Dr. Murali, you want to go ahead?
Yeah, hi, I'm Murali Ramaswamy. I'm a critical care physician and pulmonary in Greensboro. My background, I did respiratory viral research before starting practice. I do a lot of clinical trials, including most recently I did a seasonal flu trial. My outpatient interest is really in pulmonary fibrosis. My interest with viruses because of my previous experience with RSV and recent clinical trials with seasonal flu.
Thank you so much, Dr. Murali, for joining us. Go ahead, Nidhi.
Yeah, I can hear you.
Okay, Nidhi and Neetu, you want to introduce?
Sure. I'm an internist and trained in internal medicine locally here at Northeast Medical Services.
Neetu?
Hi all, I'm Dr. Neetu Nebhwani. I'm internal medicine as well, and I'm a primary care at One Medical and Nexus Care.
Thank you so much. So I'm going to start those questions. So I'm French in the Bay Area with elderly parents in France. I focus on reaching out to them by phone to break isolation feelings. It seems like the only thing I can do. Any other idea? Okay, it's a very generalized.
I think in general, making sure that they understand what really it means to practice social distancing, going over the basic rules of frequent hand washing, limiting visitor contact. You can also do some research based on where they are located in France, and you probably will know better what's their risk based on their local county, and advise them accordingly. If they're on prescriptions, advise them to get a stock of at least, I don't know if which area they are and they are in a sort of a shelter in place or not, but it's advisable to go ahead and get a stockpile of medications, stock your pantry with, dry supplies. So in case it's, in general, you want them to limit going out and social contact. So those are the things you can help them with, and monitor for any fever, cough, shortness of breath, and if they can establish a phone contact or email contact, kind of a platform with their primary care. Those are the things I would go over with.
To piggyback on that, Anushka, I would also recommend, you can use, I know this is a tough time, and not only elderly, all of us are feeling the isolation feeling, honestly. I live in a 2-bedroom apartment, and it's really, really, at times it gets suffocating. Few of the things that I would recommend in that aspect is maybe doing a video chat with them, trying to get more cousins or relatives and all of you doing kind of sort of, meeting together on a virtual platform. I think those are the things that you could try to do to help them, kind of lift their spirits up in this tough times. Just my 2 cents.
I totally agree. Dr. Murali, you want to add up, or should we go to the next question?
Yeah, so no, from a medical side, I 100% agree with both comments. On the emotional side, I personally am struggling with the same thing because my parents are in India, and my dad's a pediatrician. He's 80, and he still practices. He wants to see kids. He wants to go to the hospital and round, and he's not able to do all that. And they won't admit how they feel. They're more concerned about myself and my sister, who's a pediatrician in the front lines as well. So it's kind of interesting that way. But I'm suddenly realizing I have to make a point at least to talk to them once a day in the midst of all this. And I've not done a good job yet on that.
Oh, we're all too hard on ourselves. I think it's just a time for all of us.
I
Next.
guess, you know, what we have to stress at this point is that social distancing does not equate to social isolation, right?
Yeah,
And
good point.
then, right. And so, as the three of you alluded to earlier, I think that if patients or if people feel that they're isolated and they're socially distanced and they're not in their regular routine, it adds to stress. And such stress actually reduces their immunity even further, right? And also, one thing that we have to be cognizant of is that religious rituals, right? Their Sunday church or going to the temple, that's gone. And that adds to a significant component of comfort for this age group. And so,
Yeah.
you know, encouraging such seniors to go out and connect with their neighbors and form their own support group, you know, I mean literally like this virtual group. If one of us or if you have a loved one who's a senior citizen, go out there, train them to get on video chats on their cell phones or their YouTube, on their iPads or computers, whatever they have. If you can educate them on getting out there, that would be very helpful. And I think in addition to having a 90-day supply of medicines, and food, also if you are the primary caregiver for a senior citizen in your house, please make sure that you designate an alternate caregiver should you fall sick, right? That's something very important and it's very easy to overlook as well. And then also go over a post form with them, talk to them. If you get sick enough, what do you want to do? What do you want us to do? Do you want to go on the ventilator? Do you want us to shock your heart, break your ribs if needed? So having that crucial conversation is also very important.
Thank you so much, Ree. This was very important discussion. And I'm going to go to the next question. This is from Madhusmita Sahu. I heard that COVID-19 attacks lower respiratory tract. Just wanted to know how is it different from other respiratory diseases like pneumonia? Sorry, this question is not related to elder, but in general. Yeah, this is a good question. So one of you want to take this question? How is it different from just regular pneumonia?
So in some ways it is not, in some ways it is. There are at least 10 different respiratory viruses. Each one has different subtypes. For example, flu A, flu B. Within flu A, there are many varieties. Seasonal coronavirus itself has 4 types. Then there is parainfluenza, there is RSV, there's adenovirus. All of them collectively, they do the same thing. They enter through the nose or the eyes or the mouth. They can just limit to just a runny nose or a sinus infection, or they can get down into the lungs. So generally speaking, they all kind of behave the same, and they spread from one person to the other, through the air and through the fomites and through droplets. But sometimes each of the viruses have different seasonal patterns, and then they have like classic, profile. Like the flu, you get a sudden headache and a fever. But with COVID, it's like, slightly different with the loss of taste, the body aches that people are describing, and then a week later they get worse. So when we use the word pneumonia, what it really means is whether it's a virus or a bacteria, that one, when it gets down into the lungs and infects the lungs, that's called pneumonia. So that's a general descriptive term. And when that happens, the lungs are going to require oxygen if it's really bad. And if it's even worse, it'll require a ventilator. And all the viruses can do the same thing. It's just that with the COVID being new, it's a lot more aggressive.
Thank you so much. Yes, that's why we are and this is a new virus, so we're still learning everything about it. So next question, are you using the hydroquinone, zithromycin in the ICU for COVID-19 here?
Oh, is that for me?
I think you are intensive. So please.
Yeah. Okay. Well, we've not had a patient yet. We're just like battle ready right now. And
tell us, where are you located exactly?
Yeah, Greensboro, North Carolina. And so North Carolina is 3% of the US population. It's the 10th largest state in terms of population. But in terms of diagnosed cases, as of today, it's like 0.9% of diagnosed COVID burden. And we've had like over 400 cases. As of today, there are no deaths. And our hospital does not have a patient. And that's because we got kind of lucky with aggressive interventions from the state. But we do have an international airport. And so we've been lucky. But when these patients come, yes, I think the plan right now is to use at least hydroxychloroquine. Not sure about azithromycin.
Okay. Shri, do you have, or any of you, Neetu, Nidhi, please pitch in if any idea if in California, in critical care, are we using this combination? I know remdesivir we are using, and at least in El Camino. If you guys can.
So in El Camino and in regional, I think the ICUs are using hydroxychloroquine and azithromycin. Because I think some preliminary studies have shown that azithromycin augments the activity of hydroxychloroquine, and they're also using remdesivir. And of course, Kaletra has been found to add very little value, so it's not being used. But yes, hydroxychloroquine is being used from mild to all the way to severe disease. Azithromycin is like piggybacked on it, and then remdesivir is only for ICU people at this time.
So younger, healthy. Go ahead, Dr. Murali.
Yeah, and what are the doctors at the bedside? What's the feedback they're giving about the response of the patients to these drugs?
It's actually, anecdotally speaking, it's been good.
Oh, really?
Yeah.
Yeah.
And again, it's a very small N, so
yeah.
Take that with a pinch of salt.
I know there are trials going on in New York with these two drugs at this point. I personally don't know much about how much has been used, at least.
But I guess the way to look at it is we do not have any big alternative medications at this time. And Avigan is the other antiviral that's coming out from Japan. And I don't think the US has access to it as yet. But that's being touted as very effective too, but it remains to be seen. Not available in the US as of yet.
So, yeah, remdesivir, they're no longer going to give it out on compassionate use. It only be given for a trial. And I try to get a trial for Kazera, the one from Regeneron, but they don't need a site right now. They have enough patients in New York.
Wow.
And I'm trying to get a trial for Actmera from Genentech, so I've just put an application for that.
And you're using Actmera as an anti-inflammatory?
Well, that's what they're planning to use. We've not had a single patient yet.
Yeah. But in theory.
Yeah. But I think once it goes on trial, we'll use it on trial.
Awesome. And I know that you've not had any cases in the ICU as of yet for COVID-19, but I think we can take this offline because I think this is more technical in terms of prone versus supine and the PEEP and everything else.
Okay, and so next question from Ramesh. Thank you all. My mother, she is 70 and she arrived from India this Saturday. She's perfectly fine now. No fever, no cough, no cold. How long after can we confirm she's not affected with the virus?
I can take that. Usually you see the symptoms of this virus within 14 days. That's the incubation period, between 2 to 14 days. So if she has no symptoms at 14-day mark, you can safely say that she probably didn't contract the virus.
So she should be quarantined till then?
Typically, yes, that's the idea, especially people who are traveling and coming from country. Now, at this point, I don't know what would we call as high risk. I mean, any travel can expose you to the virus. So I would say, yes, quarantine would be a good idea.
Okay. Thank you so much, Neetu. So next question from Shruti Patel. I have heard a lot of people hydrochloroquine use as preventative medicine. And actually, I was about to ask that question in the previous one. So let's get this rolling, especially in India. Is that advisable, especially if someone has a history of diabetes and blood pressure?
Don't think there are any.
The Indian Council of Medical Research is the one that has come up with the recommendation. We do not have any similar recommendations in the United States at this time. And ICMR came up with that recommendation saying that hydroxychloroquine taken at 400 milligrams 2 times a day on day 1, and then 400 milligrams q week for 7 weeks, just once a week for 7 weeks is the recommendation. And they're saying high risk individuals like healthcare professionals and the elderly 65 plus with diabetes and hypertension may benefit from that. But again, the research is very limited, and this is all novel coronavirus, so we just have to kind of go with it.
So my understanding is so far we have no research on prophylactic use of single agent hydrochloroquine, right? Please pitch in if
there is no scientific evidence yet to support the use for prophylaxis. The clinical trials are still going on. So, India does not usually make all the recommendations based on scientific evidence. They don't have such hard, guidelines that we use here in United States. We practice more clinical based evidence. So we really don't follow what's being followed in India. This is still evolving very rapidly. You never know, by tomorrow there's large cohort where there was, a trial done and we have results from that. But so far, there's no hard evidence to support use.
But I guess I would like to add one thing to that. In theory, at least, where does all this hydroxychloroquine efficacy come from, right? So it's basically right from Harrison's Principles of Internal Medicine, which is like our holy Gita. In at least the 10th edition, I can quote the page number, but in that they say that virus is bound by a lipid outer membrane. They were studied with hydroxychloroquine, and what hydroxychloroquine does is it prevents the binding of the virus to the respiratory cells, and if they do bind and get in to the cells, they still prevent the virus from being transported to the mitochondria where they actually can replicate themselves. So in theory, it does look good, but again, in vivo studies, studies on patients are lacking.
And I do want to add where this data is coming from, just so everybody kind of have a good understanding of why we are also recommending this, apart from what Dr. Sri just mentioned is there's a small study in China that shows that there is an efficacy of hydroxychloroquine for treating COVID patients. And there is also a study from France, which is a 20 people study, which does say that hydroxychloroquine in combination of azithromycin actually does improve this COVID-19 infection. So.
And should we worry about anything, even if right now what I'm thinking, India is going to be our biggest observational study because everybody is probably using it, and we will know in the next few days does really act like a post-exposure prophylaxis. Is there anything that, everybody, I'm sure they are worried, can that be a side effect profile that we should be worrying about for just hydrochloroquine? Anything you guys want to add is so that they can educate their family, their elderly people, that what they should be watching or what tests they should be doing before starting, even if, we know India has already started it, but.
So I guess, right, there are mild to common reactions, and then there's the very serious reactions, right? And so the common reactions are, of course, nausea, vomiting, abdominal pain, headaches, mood swings that are very common with this medication. Somebody who's depressed can easily go into, more depression is the thought. And then the serious ones are, of course, bone marrow suppression, and It can suppress, the platelets formation and leukopenia, and then it can also cause anemia. It can cause QT prolongation, which is, one of the dreaded effects of it. It's an EKG change, so you will not know unless you get tested. And of course, patients with G6PD deficiency, which is like an enzyme deficiency in the blood, they can have adverse effects too. So QT prolongation is something that has to be kind of looked for before starting, especially an elderly, because you're bringing in azithromycin also as, not as a prophylactic, but as a treatment drug. And azithromycin is known to cause arrhythmias in elderly patients. So I would definitely make sure there's at least an EKG on file and somebody has looked at it and then clear you for taking the medication.
So I will just add about the G6PD deficiency. Being a hematologist, there is a 3% risk. So in India, the percentage of people with G6PD deficiency is 3%. I have had some reports that even they are giving it to kids. So it's very important. Everybody should, even if you guys are, starting it, that we do not recommend at this point of time, they should at least check the G6PD deficiency for everybody, because then it's going to be lethal for whoever. Usually G6PD deficiency will see in more younger kids, younger adults, but everybody should be tested before, because
And how do you get tested for it, Anita? Do you want to just talk about it briefly?
Again, it's a G6PD is a lab test. It's a blood disorder. You just have to order that G6PD level. Again, there are, ways to get it, but I think, if you just let your physician know, it's very easy. It's just a G6PD deficiency, test that it's a lab test. It's a blood test, simple blood test, but it needs to be done before they do, get the hydrochloroquine, especially.
And being a specialist, right, can you also add a word or two about what happens if a patient who is G6PD deficient takes hydroxychloroquine by mistake?
So they can actually go into hemolytic crisis, and it can be life-threatening. So basically all their blood cells, well, especially the red blood cells, will start hemolyzing. It can cause, make them go into shock. So very important that, they should actually be tested. It's a very simple test, but it needs to be done. There have been some reports right now that I was looking into that people are with randomly giving hydrochloroquine, and there is 1 or 2 kids who actually had G6PD and presented directly septic shock. So normal kids to septic shock, it just takes very, hemolytic hemolysis and then septic shock. No, shock, I would say.
Another question I have is that more common in Indians, G6PD deficiency, compared to Caucasians? Or?
It's not, so it's not common in Caucasians for sure. It's more common in African Americans, Mediterraneans, Jewish, but there is, any Asian country has risk. So that's why I wanted to know 3% of Indians can have G6PD. So it is also very important that we, identify that. So I'm going to just, that's about. And I think there's another risk, that cytokine release syndrome, which is another, but probably it will be seen in more elderly people, and they would have a surge of cytokine, very commonly seen with hydrochloroquine, similar drugs like that. But that's why it is not a completely safe drug. But yes, we have data for 20 plus years with rheumatologists who are using it for arthritis patients very commonly. But it is a controlled way we do it. We are not yet prescribing it. Am I correct? If you guys want to tell us, are we prescribing it for prophylaxis here in US?
No, not that I am aware of. A lot of people are asking for it, but we're not prescribing. There's no guidelines as such yet.
And what about the health?
Approached by somebody for clinical trial on healthcare workers, exactly. Randomized clinical trial, different dosing regimens. So obviously there's some interest in the US they picked up from the Indian recommendation. I just find the whole thing so bizarre. I mean, this is an anti-malaria and rheumatoid arthritis drug that's been there for decades. If it's acting on genital viruses, it probably should act even if you get a flu or RSV or any other infection. And so in some ways I think like, oh, it's just like we're just clinging to anything that we can because this pathogen is so like scary. Then on the other hand, I did give it to a patient who I thought that who might have COVID. She ended up being negative. I mean, she told me she felt she got better because of the Plaquenil. And I have a patient with pulmonary fibrosis, and years into his pulmonary fibrosis, he got diagnosed with rheumatoid, and his rheumatologist put him on Plaquenil for the inflammation, and he tells me subjectively that it's helping stabilize his fibrosis. So I'm wondering if there's some kind of if you look at Kazera and Actemera that they're studying now, like those are anti-IL-6 drugs. So there's such a strong inflammatory response that these IL-6 inhibitors are cutting down the incidence of ARDS. And I'm wondering if, like, whether it's azithromycin or Plaquenil, maybe have like a anti-inflammatory effect as opposed to an antiviral effect. Although, like, if you look at Harrison's, it talks more about the viral replication. But so I'm just like puzzled by the whole thing. Like, but if I get COVID, I want to be on the 2 drugs. And
I'm going to start the next question. I have one more question if there is time. Oh, yes, there is time.
Anita, I wanted to just add one more precaution, because I think the question was for people in India. And if your parents have high blood pressure, you want to be extra careful when you start hydroxychloroquine, because if they're on something called a diuretic, it does alter your potassium and magnesium levels. And the earlier side effect that Dr. Shri had pointed out about the QT prolongation and effect on heart, that can be really worse. So people who have parents in India, who have high blood pressure, it's a very simple question. Do you have high blood pressure? Are you on medications? Talk to your doctor, check for some drug interactions. So that's, yeah.
Just to give you a little bit of my perspective as well on this, like, my father is a diabetic and he's 70. He actually turned 70 yesterday. I'm not giving this to my dad, right? In India, I am asking them to follow the strict measures of social isolation, staying at home, like avoiding any kind of contact. You can keep these medications just in case, but I would recommend seriously, don't start these on your parents in India. It's too risky. Just tell them to monitor, like just follow really strict social isolation measures at this point.
And the hygiene measures, washing hands.
Oh, yeah.
Those are the only 2 things that we know it really works. Rest everything we are still studying.
Oh.
So, next question. I have, okay, you already addressed the diabetes and the blood pressure. I have one, okay. Does it start with, COVID, does it start with the sore throat? And if that is the case, when does drinking a lot of liquids help?
So the symptoms are very variable, and what we know in terms of studies that have come out from China and New York, that have collected the incidence of how frequently a symptom can occur in the common population, it's not, sore throat may not be the first thing that comes, but it might. So about 16% of the people have sore throat, and it might not be the first symptom. You might have a slight fever, chills, and other things before that. And what was your question? Drinking a lot of liquids. Drinking a lot of liquids in general is a good thing anyways, to keep yourself hydrated and boost your immune system. But some people have asked this in terms of like gargling. So what gargling does is kind of reduces the viral load that's attached in your throat at the point. It might relieve your symptoms temporarily, but it's not a cure. So yes, drinking a lot of liquids will help you feel better. Definitely keep up with that. Monitor if your sore throat, progresses and you have additional symptoms of fever, shortness of breath, or anything else, and then make a call to your doctor from there.
But I think the caveats to that is, if you have renal failure, you're on dialysis and you're not making urine, please make sure that you're not overloading yourself on fluids. If you have congestive heart failure, the heart doctor has told you to not go beyond a liter to liter and a half. Please respect that, because you don't want to go into another complication and end up in the hospital at this time. And of course, liver failure too. I mean, in any of these conditions, you may have fluid restrictions. So please make sure that you're paying attention to your underlying diseases first.
Thank you so much, Shri and Nidhi. This one does it start with? Okay. And these two more symptoms, I'm just going to add, I don't know if, so these two very kind of different symptoms that there's a lot of data coming out, anosmia and ageusia. What do you guys think? That is something that they can think about, or is it the common cold?
I actually have had few patients with anosmia and COVID positive. So that is, there's
Really?
definitely that, yes, there's definitely, that definitely is out there. I have not seen any other patients apart from that. Just the anosmia is what I have seen the most so far.
And
Does that come first for my own education?
So a few of my, I think like one or two patients that I actually had, they basically said that they had very mild symptoms. Like they almost felt like they had cold and they just lost sense of smell completely. And then they kept asking us and we're like, maybe it's cold, and they start feeling better. So, you know, and the anosmia is still actually present after 20 days. So.
Oh, wow.
Very typical. And I
the theory behind that is that, you know, it kind of goes after the olfactory receptors in the nose, and taste is so closely tied to smell. Yeah. So they're saying that it doesn't necessarily affect the tongue, the taste buds on the tongue, but it just goes after the, you know, olfactory, the smell receptors in the nose. Nothing to do with the brain, you know, at this stage. And they're saying that it takes a good while for these things to come back, primarily the sense of smell.
Thank you.
So it's not necessarily something that will predict a bad outcome. Is that right?
I don't know. I don't
At
think.
least not from preliminary data.
Okay.
But
Thank you.
you know, like kind of a very inquisitive, having anosmia for a few days, unless the patient has a history of sinusitis, it's something that we don't see in most of the viral, like complete anosmia. So that's something that there are a lot of studies now coming out that, you know, even a physician pointed that sudden loss of complete, there's no sense of smell, and that is so many studies with China, and I think even France is having. So that's something that we should.
And it's surely because of the you know, severity of the disease, right? I mean, there's just so much of breakdown of these cells that are occurring in the respiratory tract, beginning from the nose. So I guess that has something to do with, I mean, this is just a hypothesis again, but I'm just correlating it with the severity of the disease and the breakdown of the cells.
Thank you so much, Shri. So any point, Sanjeev, Mr. Sanjeev has this question. Any pointers to stay safe for grocery shopping once in a while?
I guess if you're following standard precautions, there should not be any problem. You know, definitely be cognizant of the fact that you're going to be touching multiple surfaces when you're on a grocery tour, right? or you know, a grocery trip. So you're going to be touching the cart. You're going to be touching multiple surfaces, you know, in the grocery store. Just imagine somebody may have sneezed on it, and you may have those invisible, you know, water droplets with the virus particles floating inside. So floating on and dried up on those vegetables. So make sure that, you know, you clean the cart with a wipe if you have it, a sanitizing wipe, if you have it, because that's so rare to come by. Otherwise, wear gloves. And then, you know, take all your vegetables. Do not touch your mouth, eyes, nose, where, you know, until you come home, and wash your hands. Right, so that is key. Just standard precautions, that's all. And of course, maintain a 6 feet distance between you and the next shopper. Yeah, that should be good. And I would defer to my other colleagues here if they have anything.
Well, one thing I did was I didn't use cash.
Oh, good one.
Yeah,
I did. I actually just I left my wallet in my car, and I was surprised to see people carrying like big bags and everything with them. And I did not take my grocery bags. So so those are two things I found very helpful. You can just take your credit card in, and you can wipe it off later when you're done. When you come to your car and you do your hand sanitizing, you can also sanitize your credit card. And the other thing was, please don't carry your purses and everything inside. And you can, this is a time when it's okay to use the paper bags, the disposable bags. So you can bring them home, remove your groceries as hygienically as you can, and you wash, like Dr. Shri said. and then just dispose of the bags, especially the elderlies, because that way, you know, you just reduce the overall risk of you know, the fomite transmission.
One of the things that I probably would like to add, and maybe I'm being a little bit more germophobic, is, you know, please wipe your phones after, because most of us carry our phones, and realizing or not realizing, we touch our phones every few minutes. That's like, you know, it's unavoidable at this point for most people. So please wipe your phone after you go out and you come back grocery shop. Do that.
I'm glad you mentioned it, because I left the phone in the car too.
Some people
You take a list, paper list, and you know, shop what you need and just throw it away in the grocery store as you leave. You don't even take your phone in. So that way you don't have to remember what all you have to disinfect. You just keep yourself, you know, minimally exposed.
Right. But by the time you come home, you probably have touched a lot of surfaces. And if the phone is in the car, and if you touch your phone, just be safe and just wipe it. That's what I do, at least like once a day, even, you know.
And other seemingly innocuous things that can transmit the virus is your steering wheel.
Do you guys have any advice about what kind of wipes to use? Is Clorox wipes good enough, or alcohol wipes? Or you know, there's a big shortage. I'm out of Clorox wipes, and it's $100.
Sure. So in terms
found something and he's gonna them to me. I found some basic alcohol wipes, and I also ordered some Hybe glands, but I kind of forgot the date of, you know, which agent viruses. I have been cleaning my phone 3 times a day. Any advice on?
I think we had some audio issue.
Yeah, I think Dr. Murali, your audio was breaking, but it looks like what you asked was what kind of wipes is good enough in this situation?
I think Murali's video is frozen too.
Oh, okay.
Really?
Yeah, now it's back.
Oh, okay. Sorry. Okay, yeah. Question is about, can you guys hear me and see me?
Yes.
Yeah. What kind of wipes to use?
So
Any, like,
I guess beggars can't be choosers, Murali. There's none available.
I know, that's why I'm asking.
Yes, no, but it's a great question. You know, I think Clorox, it touts itself as like 99.99% efficacious, right? So I think that would be your number one choice. But if you can't, then you can make your own alcohol wipes at home.
Okay. Or if you go to the store, basically the way to verify if a disinfectant is going to be efficacious or not, because, you know, I go to Sprouts and they have this whole aisle of sort of organically made disinfecting agents, and I always wonder, are they good enough to kill the virus? So I mean, what CDC is recommending, they have a list of EPA registered disinfectants, household disinfectants, and I was surprised to find a whole list of names that I was not familiar with. Sodium hypochlorite, there's peroxide, there's a lot of things. So if you have something at home or you find something in store, one quick thing you can do is see if the label says an EPA registration number, then you don't have to worry about anything, then you're good. Now we're rapidly running into a situation where we really do not have any choice. And one thing I you know, to be creative, a lot of people have liquid chlorine bleach at home.
Yes.
And, you know, you add what, 1/3 cup in a gallon, or 4 tablespoons in about 1 quart of water, and you make that mixture and you keep it in a bottle. And I'm assuming if you have paper towel or even, you know, disposable towels or anything, you could spray that and use that as a wipe.
Because great idea, thank you.
And actually make sure that you prevent yourself from inhalation injury too, because bleach has very strong odors.
We have the concentration, not in the concentration of this. Yes, be careful. You know, the household cleaning bleach that comes doesn't really pose that much of a risk, but yes, you should be careful when you're making the solution.
What about hydrogen peroxide? Can that be used as a disinfectant? Is there any data for that?
There is, you have to follow the directions on the bottles based on the concentration. As the problem is, some of them require you to leave on the surface for a certain amount of time and let it dry. And a lot of people just quickly apply and then wipe it off with a dry towel. So inadvertently, you're kind of disinfecting, but you're defeating the purpose too. So know your agent, know the right method, and then do it.
I actually have a list open from the CDC, and hydrogen peroxide is on it. And actually Clorox uses hydrogen peroxide. So
Yeah, that's what I thought.
Okay, I'll look up the list. Thanks, guys.
Yeah, anybody can access the CDC website and just look at how to clean or disinfect home. And there's very useful information that anybody can access. And I would highly recommend for everyone to go through that. It actually also goes over how to clean different surfaces, if it's your carpet, how to do your laundry, how to take care of your pets. So, I'm sure, in the interest of time, we can't go over it, but for people, it's a good.
I do feel CDC has better guidelines when it comes to people, general people, compared to
doctors,
healthcare providers, true.
I agree 100%.
People can follow CDC more commonly. We are probably not able to anymore, believe or kind of stick to what CDC says, just because of they think healthcare providers should be wearing bandanas and scarves.
There's a loss of faith there for me.
Exactly, that's exactly what has happened. But I think for people, they are recommending everyday disinfecting. That is amazing. And then to get creative, what Dr. Nidhi and everybody else told us. Next question. What is the implication of remdesivir getting exclusive patent to Gilead for India, etc.? Is it effective for COVID? Anybody of your... Shri, you want to take this?
I have no idea.
Oh, you.
I think what my friends in Delhi, in Delhi, there are 3 hospitals who are treating it, and they're contracting because remdesivir is on, this is the only drug that has been widely used in treatment protocols all over the world. It has 6 trials at some point, 2 in China, 4 in US. I don't know, all 4 in US are still open or not. Plus, in addition, they're offering it as compassionate use. So I think, given the population of India and given the fact that it's still kind of in phase 2 of the pandemic, they should be reaching out and making sure that they have supply as they need. I don't know what was.
I think that
the question, but that's my suggestion. That's my feeling for it.
So we are getting some data that remdesivir, even for US, we are running into shortage.
Yeah.
Also the fact that it is right now used only for ICU patients, elderly ICU patients, which and it is a very hepatotoxic.
And we have run out.
And we have run out, exactly.
Even for ICU patients, we have run out.
Exactly. So right now the situation is we don't have enough for US. I don't know how India would be able to get this cost.
And mind you, right, Gilead is basically based in the Bay Area, right?
That's why we are able to get.
And we have run out. And so the compassionate use clause is gone. So they're no longer honoring that.
I totally agree. I think it's going to be very difficult. So right now for India to get remdesivir.
So I guess prevention is really worth an ounce of cure in this case.
Yes. So that's our observational study, the whole of India.
I want to shout out to our minister, honestly. I do want to shout out to him. Like, he's done.
Hats off. I agree.
I really agree.
Like, the kind of leader he is, I just feel right now that I'm in the wrong country.
Mm-hmm.
As a medical professional, the reason why we all came here was because this is number 1. But suddenly I've started having less hopes from USA. Sorry to say that, but that's the fact right now.
I share the same feeling.
Yeah, I think most of the physicians are feeling this way. But let's go to the next question.
Hey guys, is it okay if I break off because it's
Yes.
10:20 here?
I know. Thank you so much, Dr.
Yeah, well, I'm happy to do it. Participate again. I'm learning a lot myself, so appreciate it.
Thank you so much. And
Bye, Murali.
Bye. Thanks. See you guys again. Yeah.
Yeah.
we'll just take,
Have a good night. Stay safe.
thank you. We'll
Thank
just
you.
and then we'll-
Bye.
Bye.
thank you so much. Good night.
Good
My
night.
husband started out with nausea and stomach pain. I heard that these are some of the initial symptoms of COVID. Should I be concerned or watch out for any other changes? He's 43 and has no other health conditions and under no medications.
What was the question again, Anita?
So it's a 43-year-old male who started having stomach pain and nausea, and he has no past medical history, no medications. Could this be COVID initial symptoms?
Look, I think this is not a platform to diagnose individual patients as COVID or not COVID, but I think diagnosis is kind of binary at this point in every situation. So assess your own risk. If if your husband falls into a higher category of risk exposure, then definitely get tested, because testing is more commonly available, and until the results come back, self-quarantine. But if the stomach pain is very severe, please go ahead and seek medical professional advice ASAP, because it is wrong on our part here to not know anything about the patient and make diagnosis calls. It's just not appropriate.
Thank you so much, because we have made it very clear. It's not a telemedicine platform. It's just educational for everybody.
Correct.
So I think, could you please write down those terms? Okay, so Dr. Nidhi Gupta already took care of the anosmia and ageusia. What makes elderly people so prone to this disease? Is it cause of underlying causes, or there's a different side to it? Very good question. And anyone?
Yeah, so I think, just looking at the propensity of this virus to attack elderly people, in China, 80% of the dead, were citizens greater than 65 years of age, right? In Italy, the average age of the person dying is 81. So it really loves old people. Why it loves old people, I don't know. It just loves old people. Not to say that, it is not infecting the youngsters, but 43%, I think, of patients overall who were hospitalized were the elderly. And I think out of that, 55% went to ICU. And I think, 80% of the mortality came from above 80.
But I would add here, we should not take this as lightly. Right now, we are seeing much more incidences and critically ill younger adults, as well as some kids. Yeah, there's a 12-year-old kid who is intubated and in ICU right now. They are 20s, 40s, 30s, every kind of,
No one. And we came across a 12-year-old in Atlanta who was intubated.
Yes.
I just want to add something to the question, or to the answer of Dr. Shri about the elderly population. You also have to realize that any kind of infection, when elderly people are, getting not just COVID, but any infection, their immunity is not as robust as younger people. So they're not able to fight that infection as a younger person would fight. And I think that's one of the reasons that I can think of why this infection is more severe in elderly population.
Thank you so much. I think just last question. Can we use vinegar to wash fruits and veggies from grocery store? If the question is, would that help for killing COVID? Is that probably that's the question? Is there any data to support vinegar can help killing COVID?
There is no data, but please do not replace it with the regular washing. But after the regular washing, if you want to use vinegar, I know I do wash my fresh produce in diluted vinegar. So, but thorough washing, multiple washing, and then, vinegar is not, there's no data to support or against. So
what would you suggest having so fresh produce they cannot cook? If they can cook, everything should be cooked and eaten, probably, right? That will definitely kill the virus. At least boiling would definitely kill. Is there anything we can do? Can we like wash with soap and water? That I don't know, it's just a weird thought, but
I was thinking the same. Don't worry.
Like, that's the one thing we know does work, but is that something we can do?
I think washing thoroughly. So there are vegetable washing solutions that come that I've been using for long, and they're vegetable oil based. So just like how you would normally wash, just you make sure you watch your hand hygiene. Before you touch your produce, you wash your hands. The surface is cleaned, everything else is cleaned, and you wash it thoroughly. And after washing, before using, you make sure you haven't touched any other surface that might be contaminated. You're not coughing into your hands, covering your cough, those kind of things. The only thing in terms of food that I was thinking, and this is just my thinking, is not eating like the refrigerated, like the bakery stuff, because that you cannot heat. And if that's contaminated, there's no way of washing it or cleaning it. So, that's the one thing that I was thinking, because, we used to get cakes and pastries and stuff. So I'm not doing that anymore at all, because there's no way for me to disinfect it before eating. You don't heat those things.
Exactly. I think that's the challenge with these things. I think there's one more question, but that we will address. That's going to be a long question, Krish. Sorry, it's the flattening of the curve. We will address that in the next session. It has been more than an hour. I think we'll call it a day today. Thank you, everybody, and thank you, the panelists, for participating and giving such a good insight into everything. Really appreciate all your time. Thank you, and we will meet again on Friday. We have a meeting just with the MDs to discuss but yeah, the public meeting would be on Friday, and we'll take it from there. Really appreciate all of you.
Thanks, Anita.
Thanks,
Thanks, everybody.
Bye, Neetu. Bye, Nidhi.
Bye, guys.
Thank you.